My name is Dr. Tommy Lim. I'm an optometrist in San Jose, California.
And web information?
www.berryessaoptometry.com, which is BerryessaOptometry.com.
I'm talking this morning with Dr. Tommy Lim, and the World Allergy Association, the organization, it says that the number of people in America who are affected by allergies is just growing by leaps and bounds every year. And in fact, the number of sufferers in the U.S. is well over 34 million adults and kids. Before we talk specifically about the eyes, let's talk about allergies. What do you mean when you're talking about an allergy?
The symptoms and severity will vary, but most patients will complain of a runny or stuffy nose, sneezing, and a sore throat. As eye doctors, we commonly hear about red, itchy, and watery eyes, as well as swelling around the eyes. But the bad thing is, unfortunately, allergies often go untreated. It's not taken seriously by patient and sometimes even the doctor, because allergies are considered as more of an annoyance rather than a potentially serious problem. So how many times have we heard our patients or our friends say, oh, it's just my allergies acting up, while they suffer all day long, irritating runny nose as well as sniffles, as well as the eyes being irritated. So the eye doctor needs to work closely with the allergist, developing an interdisciplinary approach to caring for patients with allergies.
What triggers these allergies, in quotes, in most people?
The most common is pollen, which you encounter when you go outside, but especially being in a park, working in your yard, or sometimes just the towns that we live in. So the pollen, the dust in our homes, pet hair. So what we want to do, that's always the best, the avoidance of this. And what oftentimes will also help is a cold compresses. By putting a cold rag over your eye, what that will do, it reduces the swelling around the eyes as well as the itching. So what we want to do, if it doesn't do the trick, what we then need to do is we start the patient on a mild antihistamine, which is, interestingly enough, about 10 plus years ago, probably was a prescription drop. So if that does not relieve the symptoms, then the doctor would then prescribe a stronger eye drop or a stronger antihistamine. And now we're talking about a prescription drug. Really what happens is there's really many layers of this treatment plan for a patient with eye allergies, and it all depends on the specific eye irritant itself and the individual patient's response to the prescription eye drop or systemic drops that the allergist is prescribing. Following this regimen that we're talking about, the majority of the patients with eye allergies should find some improvement, but really what they should do is speak to their specific eye doctor for a treatment plan tailored to their specific situation.
Why do you suppose that the number of allergy sufferers seems to be growing?
That's a good question. I think it's because there are so many things in the air now that are probably irritating us more than in yesteryear.
Lots of people try to ignore their allergies. What's the downside of that? I don't need to go to anybody to fight this allergy. I'll just live with it.
The problem with that is we're talking more the extreme case here, where this mild allergy develops into a more moderate than a more severe one. And then if you have underlying health issues such as diabetes, lung issues, it makes that even a worse case.
When working with an optometrist and or an allergist, is the goal to cure the problem, or is it just to make it more comfortable for the patient?
It's really to make it more comfortable, because it's something that will really vary each year depending on the environment. You may be better, you may be worse. As we get older, we may be better or maybe worse as well. And we have some people who have had allergy shots all their life or a good part of their life. And sometimes they improve, sometimes they don't improve. So it's really an individual situation, because it really will probably be maintained, but it will be maintained at a different level every year, and the severity will vary.
Anything else you want to add?
No, I think that's the main thing. Is just listen to your body, and if something is bothering you, there's a reason. And sometimes you can only minimize the problems that you have, but it definitely would behoove them to research this and look into it, because they can be helped in most cases.